Hello everyone, welcome back to the 500 MCQ series of Drug Inspector exam. So in today's discussion, we will be discussing questions from 16 to 20. So as I've already told, while I display the question, you pause the video for 5 seconds, you can register your answer and then you can resume the video to find out the correct answer and discussion. So without any delay, let's move on to the first question of the day. The question is, number of chiral carbon in penicillin G. 1, 2, 3, 4 or 5. So first of all, you need to know what is a chiral carbon. So a carbon which is attached to 4 different groups, a carbon which is attached to 4 different groups, they are called as chiral carbon or asymmetric carbon. Chiral carbon is also called as asymmetric carbon. Now this is one of the conditions for a compound to be optically active. So for a compound to be optically active, one condition is that they should contain chiral carbon or asymmetric carbon. Okay. Now here the question is the number of chiral carbon in penicillin G. For that we need to know the structure of penicillin G. So what is penicillin? Penicillin G belongs to a category called as beta-lactam antibiotics. Beta-lactam antibiotics. So what is beta-lactam ring? So this structure is called as beta-lactam ring. Now in the case of penicillin which is a beta-lactam antibiotics, one of the ring is beta-lactam. The second ring is thiazolidine ring. So penicillin is a combination of beta-lactam and thiazolidine ring. Okay, now this is beta-lactam which is attached to thiazolidine. So this is the thiazolidine ring. So this is beta-lactam and thiazolidine ring fusion of the beta-lactam ring and thiazolidine ring. Now in the case of the general structure of penicillin contains 2 methyl groups at this position, CH3, CH3. I'm going to draw the general structure of penicillin. So there is a carboxyl group at this side, and at this position there is a RCONH group. RCONH group. So this is the general structure of penicillin, and the numbering is: this is the first atom, this is the second atom, this is the third atom, this is the fourth atom, fifth, sixth, and seventh. Okay. Now the question was the number of chiral carbon. So here the atom C, the third atom, that is C3 is a chiral carbon because it is attached to 4 different groups. One group is carboxyl group, another group is nitrogen, another bond is attached to carbon, and there is one hydrogen at this position. So all 4 groups are 4 different groups. So C3 is a chiral carbon. Now if you look at the 5th position, or C5 carbon, that is also chiral because this carbon is attached to sulfur, one bond to nitrogen, another bond to carbon, and there is one hydrogen at this position. Okay, so all 4 groups at C5 are also chiral. Similarly, C6 carbon is also chiral. So C3, C5 and C6 in penicillins, they are chiral carbons. Okay, so how many chiral carbons are there? There are 3 chiral carbons, and they are C3, C5 and C6. Okay. Now coming back to your question, the number of chiral carbon, the correct answer is 3 and choice is C. Okay. Now coming to the second question of the day, which of the following ACE inhibitor is not a prodrug? A choice ramipril, B choice lisinopril, C choice perindopril, D choice enalapril, and E choice fosinopril. So first of all, you need to know what is this AC. Okay, so AC is nothing but angiotensin converting enzyme. And what is the function of that? Yes, normally you know that in our body, angiotensin 1 is converted to angiotensin 2 with the help of an enzyme called as angiotensin converting enzyme, ACE. And what is the function of angiotensin 2? Yes, it is a potent vasoconstrictor. So when that means it constricts the blood vessel. If the blood vessel is constricted, what happens to the BP? The BP will increase. Okay, there will be an increase in BP. So that means angiotensin is a potent vasoconstrictor and it will increase the blood pressure. Now if you wanted to decrease the BP, that means you need to reduce this angiotensin 2. For that you can inhibit this enzyme. If you inhibit this angiotensin converting enzyme, angiotensin 2 production will become less and BP will come down. So such drugs which inhibit the AC, angiotensin converting enzyme is called as AC inhibitors. Such drugs are called as ACE inhibitors. Okay, so AC inhibitors are drugs which inhibit the enzyme angiotensin converting enzyme, and they are mainly used as an anti-hypertensive drug. They are given to reduce the BP. They are anti-hypertensive drugs. Now another point you need to remember, the name of the examples for the drug or the name of the drug end with the name PRIL, P-R-I-L. So if you look at the drugs belonging to AC inhibitor category, the name of the drug will be ending with the PRIL, P-R-I-L. So if you all these drugs which is given in this choice, they are AC inhibitors, and you can see that Ramipril contains PRIL, Lisinopril contains PRIL, Perindopril contains PRIL, Enalapril contains PRIL, Fosinopril contains PRIL. So all AC inhibitors are PRIL drugs. They are PRIL drugs, and they are all are prodrugs. You need to remember this mnemonic. All ACE inhibitors are prodrugs. They all are prodrugs. That means they are inactive. They have to be converted in the body to the active form. So all AC inhibitors are prodrugs, except there are two exceptions, except LC. What is LC? L stands for lisinopril, C stands for captopril. So these two drugs, that is lisinopril and captopril, they are not a prodrug. They are not a prodrug. They are active forms. Whereas all other prodrugs, whereas all other AC inhibitors, they are prodrugs. Okay. Whereas lisinopril, captopril, they are not a prodrug. It is not a prodrug. Okay. So here, Ramipril is a prodrug. Lisinopril is not a prodrug. Perindopril is a prodrug. Enalapril is a prodrug. Fosinopril is also a prodrug. Okay, so the correct answer for this question is lisinopril. The choice is B choice. Okay, now one more question will come from this area. What is the active form of these prodrugs? For example, Ramipril is a prodrug. So what is the active form of that drug? Okay, so just you need to add the word AT. Just add the word AT to these drugs. That is the active form. For example, Ramipril is a prodrug and the active form is Ramiprilat. Ramiprilat. So the active form of Ramipril is called as Ramiprilat. You just need to add the word AT. Now lisinopril is not a prodrug, it is as such active, whereas perindopril is a prodrug and the active form is, yes, it is perindoprilat. Perindoprilat. Just add the word AT. Enalapril is a prodrug, so the active form is enalaprilat. Fosinopril is a prodrug, so the active form is fosinoprilat. So in all this case, you just add the word AT, you will get the active form of the drug. Okay. So remember this mnemonic, all AC inhibitors are prodrug except LC. Okay. Let's move on to the next question. All of the following is which of the following is a water soluble drug? A choice, physostigmine. B choice, tacrine. C choice, pyridostigmine. D choice, rivastigmine. E choice, galantamine. So first of all, what is the speciality of these 5 drugs? What is the speciality of these 5 drugs? Physostigmine, pyridostigmine, tacrine, rivastigmine. What is the speciality? They belongs to a category called as cholinergic drug. They belongs to the category called as cholinergic drug. Cholinergic drug is also called as parasympathomimetic drug. Parasympathomimetic drug. Okay. Now you know that cholinergic drug can be divided into 2 categories. One is the directly acting drug That means they go and bind to the receptors directly. The second category is indirectly acting drug. Indirectly acting drug. They do not go and bind to the receptor. However, they will inhibit the enzyme called as acetylcholine esterase. They inhibit acetylcholine esterase. Therefore, they are also called as acetylcholine esterase inhibitor. The example for directly acting drug, you know that acetylcholine is a directly acting drug. Methacholine, carbachol, bethanicol, pilocarpine. They are all directly acting drugs. They go and bind to the receptors directly. Now coming to the second category, indirectly acting drug or ACHE inhibitor, acetylcholinesterase inhibitor. Acetylcholinesterase inhibitor. So let me draw indirectly acting drug or acetylcholinesterase inhibitor. They can be divided into two categories based on their solubility. So one is lipid soluble. The second one is water soluble. Now which are the examples coming under lipid soluble indirectly acting drug? The main example is physostigmine. So physostigmine is a lipid soluble drug, whereas neostigmine is a water soluble drug. Neostigmine. Another example is pyridostigmine is water soluble. Edrophonium is water soluble. Then ambinonium is water soluble. Ambinonium. So all these four drugs, neostigmine, pyridostigmine, edrophonium, ambinonium, they are water soluble category, whereas the main drug in lipid soluble category, physostigmine. Other than physostigmine, tacrine is lipid soluble. Tacrine. Rivastigmine is lipid soluble. Rivastigmine is lipid soluble. Donepezil is lipid soluble. Then galantamine is lipid soluble. So these drugs, you please remember, the drugs coming in lipid soluble category and the drugs coming in water soluble category. So physostigmine, tacrine, rivastigmine, donepezil, galantamine belongs to the lipid soluble category, whereas neostigmine, pyridostigmine, edrophonium and ambinonium belongs to the water soluble category. Now why this physostigmine, tacrine, they are lipid soluble? Because they contain, the nitrogen is a tertiary nitrogen. The nitrogen atom present is tertiary nitrogen, so that it is lipid soluble and they can cross the membrane. Whereas in the case of neostigmine, pyridostigmine and ambinonium, the nitrogen atom is quaternary nitrogen. Okay, so these 2 points also you please remember. Now the question here was which one is water soluble? So physostigmine is lipid soluble, tacrine is lipid soluble, rivastigmine is lipid soluble, then galantamine is also lipid soluble, whereas pyridostigmine is water soluble drug. So the correct answer is C choice, pyridostigmine. Okay. Now coming to the next question, which of the following is an example for a mineral fiber? Which of the following is an example for a mineral fiber? A choice nylon, B choice hemp, C choice asbestos, D choice pterylene and E choice rayon. Okay, so first thing you need to remember, fibers can be divided into mainly 4 categories. One is plant fibers. Second one is animal fibers. The source of origin is animal fibers. The third one is synthetic fiber. We can synthetically prepare fibers, synthetic fiber. And fourth fiber is basically obtained from the mineral source. They are called as mineral fibers. These are the 4 different classifications of fibers. Now coming to the examples for plant fibers, cotton is an example for plant fiber, jute is a plant fiber, flax is a plant fiber, then hemp is also a plant fiber. Whereas silk and wool, they belongs to the animal fiber category. Whereas nylon, terlin and airloan, they belongs to the synthetic fiber category. Whereas glass and asbestos, glass as well as asbestos, they belongs to the mineral fiber category. Okay, so you need to remember plant fibers, animal fibers, synthetic fibers and mineral fibers, and glass and asbestos, they are examples for mineral fiber. So here the question was which is the example for the mineral fiber. The correct answer is C choice, asbestos. Okay, now here the nylon basically they belongs to this synthetic fiber category. Hemp is a plant fiber. Terlin again belongs to synthetic category, whereas rayon is an artificial silk. Rayon is nothing but artificial silk is called as rayon. Rayon is artificial silk. Okay, so hope you understood this question. Moving to the final question of the day. The question is the essential amino acid present in Melphalan. Okay, so first thing you need to know what is Melphalan. So Melphalan, we know that it is an anti-cancer drug. It is an anti-cancer drug. To which category it belongs to? Yes, it belongs to alkylating agent. The mechanism of action is alkylating agent. What is the chemistry of this compound? What is the chemistry? Yes, it belongs to a category called as nitrogen mustard. The chemistry is that it is a nitrogen mustard. The mechanism is alkylating and is an anti-cancer drug, and is mainly given for multiple myeloma. It is given for multiple myeloma. Okay, so these are some of the important points you need to remember regarding Melphalan. Now, if you draw the structure of this Melphalan, the structure would look like this. There will be a nitrogen. There will be CH2 group, as well as chlorine. Here to this nitrogen, one CH2 group, and one chlorine will be there, and there will be an R group. So this is the general structure of nitrogen mustard. Now, if this R group is phenylalanine, such nitrogen mustards, is called as Melphalan. They are called as, if R is phenylalanine, then it is called as Melphalan. Okay, so in Melphalan, the R group is phenylalanine, which is an essential amino acid. That means you have to take it through the diet. Okay, now you can remember from the name itself, you can remember Melphalan contains pH phenylalanine. Okay, so from the name you can remember it contains phenylalanine. Okay, so the amino acid present in Melphalan is B choice phenylalanine, which is an essential amino acid. So hope you understood this discussion. So keep on watching our videos. Thank you.